I'm stepping in for Peter today, so some big shoes to fill. I'd like to advise that this meeting is being live streamed. Let's just start with a round of introductions. So we go through the people online. Helen, please introduce yourself.
Hi, I'm Helen Raisin. I'm a consultant in public health and AD here at London Borough of Merton.
John Morgan.
Hi everyone, I'm John Morgan. I'm the Strategic Director, Integrated Health and Care in the London Borough of Merton.
Karen Worthington.
Hi, I'm Karen. I'm a GP in Merton, and I'm also the named GP for Child Safeguarding in Merton.
Catherine Eames.
Hi, good evening everyone. Catherine Eames, Director of Regeneration and Planning at Merton.
Luke Squires.
Hello everyone, my name's Luke Squires. I'm a public health principal and I'm here with Max Latif, our new young inspector as well.
Max Latif.
Hi, I'm Max Latif. I am the new young inspector in the public health team.
Megan.
Hi everyone, I'm Megan. I'm the Public Health Partnerships Manager.
And Sarah.
Hey, I'm Sarah Goad, CEO at Age UK Merton and Voluntary Sector Representative.
Okay, if we just work our way around the room from the right.
Hi, Tony Rice, Shadow Lead Health and Social Care.
Welcome.
Russell Stiles, I'm Director of Public Health for Merton.
Tony Malloy, CEO of Merton Connected.
Evening, I'm Dean Tyler from London Borough of Merton. I'm Assistant Director for Policy and Strategy. Thank you.
Terry Clark, Executive Director for Adult Social Care, Integrated Care and Public Health at the London Borough of Merton.
Sarah Rushton, I work for South West London ICB. I'm Head of Primary and Community Care Development and Delivery for Merton and Wandsworth.
Evening everyone, I'm Councillor Osama Kawesa and Cabinet Member for Children's Services.
And just for noting, Nicola De Silva, who was the young inspector, has now taken up an internship elsewhere. Nicola's done a huge amount of work across a number of different projects, and I think we've got a new young inspector on today. I think that's Max, isn't it? So welcome, Max. I'll assume that you've all read all the papers. There's a lot of detail there, and the speakers will be going through the salient points when they are presenting. Obviously, I've encouraged questions, but we want to try and keep questions on point and succinct. Today's agenda is slightly shorter because there are a number of papers that will come later on in the year with much greater detail. In terms of apologies, we've got Bev Hendricks. I know we've got Christine who's stepping in for her, Jeremy Smalley and Catherine stepping in for Jeremy. Mark is also given apologies, so John is covering for that item at the end as himself. And are there any other apologies that need to be given for today? No? Okay. In that case, let's just move on to declarations of interest. Are there any declarations of interest that anybody would like to declare for today? Just checking online. No? Okay. Well, let's move on to the minutes. Are there any objections or amendments suggested to the minutes from the last meeting in March? No, in that case, I will sign the minutes later. Let's move on to the first agenda item, which relates to Health and Wellbeing Board Development. Russ, you're giving a verbal, aren't you? You've got about 10 minutes.
Thank you, Chair. So in the planning of board this evening, we thought it'd be useful to give an update on some recent system development changes and the role of the Health and Wellbeing Board in relation to those. So in the last 12 to 18 months, there have been significant system changes across health, care and wider services. As the statutory partnership that provides overall vision and direction for health and wellbeing in Merton, it's the board's role to utilise our collaborative working to respond to these developments, whilst ensuring health and wellbeing of our residents remains at the forefront. So key developments include the NHS 10-year plan, which sets out government's vision to transform the way health and care services are delivered through a neighbourhood health service that brings care closer to home. The neighbourhood health framework was published in March, and sets out the national direction for achieving the shifts that are needed, supported by more integrated population-focused approaches. It positions health and wellbeing boards as the forum for collective leadership across the system, bringing partners together to shape how neighbourhood health is developed and delivered. As a key part of this work is progressing on Merton integrated neighbourhood teams to establish a model of working, including a test and learn pilot that will be delivered from September, overseen by Merton Alliance, supported by the wider system. We've also got co-hosting arrangements in terms of London Borough Merton and Merton Health CIC, the GP Fed, as co-hosts, which is also supporting neighbourhood health development. So to deliver this in Merton, we need to ensure our strategic neighbourhood health plans align with our health and wellbeing framework. We ensured our health and wellbeing strategy from 2025 to 2030 was developed to be agile and flexible to emerging neighbourhood health plans. And we will utilise the architecture set out in it to fulfil these new requirements. In particular, the fifth priority, which is joined up services, will be core to delivering on neighbourhood health. The guidance has also been clear that while health and wellbeing boards are being asked to shift into a slightly different role remit to ensure the implementation of neighbourhood health, health and wellbeing boards are also encouraged not to default to a treatment health service centric narrative to crowd out our ambitious upstream wider determinant and prevention priorities. So our health and wellbeing strategy will continue, therefore, to focus on the 80% wider determinants of health and wellbeing, which remains essential to improving population health outcomes. We've reached out to the LGA, the Local Government Association, to support us to implement some of these changes. Our discussions so far have focused on governance, ways of working, how we can work to support our board members with these changes, clarify the local executive purposes and ensure strategic continuity to improve population health. So with the endorsement of the board, when the expression of interest process opens up for applications, we will put our board forward. This will provide, we hope, the opportunity to work with the LGA and for them to help facilitate discussions, clarify governance and partnership arrangements, and provide some recommendations and support for our board to maximise the impact over this coming term. Alongside this, we'll be looking to update the terms of reference for board. They were last formally updated in 2015, so it's way past time to take account of these changes, but this needs to follow a formal process. In Merton, any changes to terms of reference needs to go to the Health and Wellbeing Board first for ratification, then LBM Governance Standards and Audit Committee, and then full council. So there's quite a process in place, but that's what we will endeavour to do in the coming term. I'll stop there, Chair. Thank you.
Thank you, Russell. Any questions? Councillor Kwesi?
Thank you. Just a clarifying question there, Russell. In terms of putting ourselves forward to work with the LGA, the ask from what is the ask of the board? Like what would, I know you said we would have to update our terms of reference, and I can see the benefits in terms of getting the LGA's input in the work of the board as we take on all of these changes. But what are the other requirements of the LGA for us to be a partner in this?
Yes, thank you, Councillor. So they offer various different packages, and we envisage bidding for the one where they come in and do a kind of joint workshop with us to look at our roles and remits across the board and how we're trying to shift the board into kind of position for particularly around things like neighbourhood health ambitions. So they will come in, they'll do some I guess some training in terms of the role of the board, the remit of the board, and they're well rehearsed in this because they've done it for lots of other local authorities, and they run a rolling programme. And you know, I think it's very timely. A point it's a point in time where I think we could really look to them to support us with how we move forward, given the changes I just outlined.
How long is that collaborative relationship?
It will be it depends. There's various there's kind of full process where we will get some support over 6 months, and then there's kind of lighter processes where they just link us up with other boards and we almost do kind of peer support for each other. It depends. It depends how successful we are with a bid. Can I say this? One of the people I spoke to was a Merton resident, so I hope who's at the LGA. So I hope that we're strongly placed once the bidding opens up. I understand, Megan. Can you just clarify? It's sometime in the next couple of months, I think, isn't it? They haven't set an absolute date.
No, that's right. I contacted them again a couple of weeks ago just to double check that we were on track to get the information. So they know that we are waiting to put our expression of interest in. They originally said it would be across the summer, but it feels like we're there now. So hopefully soon, in the next few weeks.
Any further questions? And it sounds like a really exciting opportunity, doesn't it? And long overdue, given the terms of reference are about 11 years old as well. So I note the presentation, Russell. Does everybody endorse the approach where we will be applying to the LG to hopefully have them involved in supporting us with board development? It sounds like an excellent idea. I'm seeing nods of affirmation in the room and online. Excellent. Now, Russell, I know you were going to introduce the next item, and I understand that Christina isn't here yet. Do you feel able to continue to move on to that item, or should we move on to one of the later agenda items?
Well, Chair, I can introduce it and start with the prevention priority, and then hand over to Dean and Tony for the strong communities. So we could probably come back to start strong if Christina's able to join. Would that work?
Let's do that. I'm happy with that.
Thank you. So the development of the Year 2 action plan has been undertaken in the context of a look back, look forward process that we outlined in the strategy when it was endorsed last year in March. It allows us the opportunity to reflect on all the activities set out in the Year 1 plan, stop actions where they have been completed or are now embedded in ongoing business as usual work, continue or enhance actions that have worked, and respond to evolving priorities and needs of our communities with new actions. So the new plan we are presenting to board for endorsement tonight sets out Year 2 actions with relevant monitoring groups for priorities 1 to 4. The pack also includes considerations of potential activities in Year 3 to 5 of the strategy. So I'll move on to the second theme, as Christine's not here, which is the prevention theme, for which I'm the SRO for. The full list of actions is in the pack, but I will just highlight a couple. So for example, we've proposed a Year 2 action to deliver a prevention exemplar through a system response to CVD, cardiovascular disease prevention, linked to the Pan London Million Hearts and Minds programme. So Million Hearts and Minds is an ambitious London-wide movement to save lives and reduce disability by helping Londoners avoid heart attacks and strokes. Over 5 years, it aims to improve the heart health of Londoners. It will prevent problems early by finding and treating high blood pressure, cholesterol and diabetes, and helping people make healthier choices around food, smoking, weight and activity. So we're keen to be a hearts and mind trailblazer, working across health, social care and VCS to take action with clinical care and improvement, holistic community support and healthy place environment. Another year 2 action is partnership implementation of the Eat Well, Be Active strategy and action plan. And that will run from 2026 to 2031, so over 5 years. This work takes a life course approach and has 9 objective areas. This also provides the opportunity to align and implement recommendations from my annual public health report for 2026-27 Merton on the Move. A final draft of the Eat Well, Be Active plan was discussed at the recent Merton Health and Care Partnership on the 2nd of June and at the multi-agency Eat Well, Be Active steering group on the 9th of June. It's due to be published in summer and the final version will be circulated to the Health and Wellbeing Board members for comment outside of the meeting and prior to publication. Other year 2 actions include new areas of focus for our board, for example, understanding and responding to gambling related harm in Merton. So I'll stop there and hand over to Dean and Tony for Strong Communities.
Good evening, everyone. With Strong Communities, we recognise that stronger communities is both its own distinct area and a thread that runs through the entire strategy, and this relates it back to the original Marmot principles. When we look at the 6 strong actions, they coalesce around 6 themes. So one is co-production, another is hearing the unrepresented, capacity building the sector, so growing the sector so there's more things we can do, more places we can reach. Delivering civic pride, so looking at how the civic pride grant can be delegated properly, fairly and meet the needs of the borough. Looking at engagement and growth, and finally safety and being heard within people's own communities. To build on these 6 key themes or action points, we've built a clear evidence approach where we feel we've all landed on within our group. One is around capacity building in terms of how we can recall different actions. The others around partnerships and partnership developments, networks and amplifying the sector, and fourthly, volunteering opportunities and increasing those. I'll hand over to Dean.
Thanks, Tony. Thank you, Chair. We were told to be brief, so we've rehearsed what we're going to say this evening so that we can remain focused on the task. So I'm not going to repeat anything that Tony said. I thought from the Council's perspective it was important that our strategic partner Merton Connected introduced the update to the Health and Wellbeing Board for the action plan on stronger communities. And I'll just add a couple of points of strategic context. The first is to reaffirm the close working between Merton Connected and the local authority on the final year of delivery for the Council's interim voluntary and community sector and volunteering strategies. These were approved as interim strategies by the Council's Cabinet last year to provide a degree of continuity and stability for the sector and the important work that we do to strengthen communities during this year. What we're currently doing as an organisation is now working on the next step beyond those interim strategies that will run out in 2027. So that's just an important bit of strategic context within which this work fits. And of course, the Health and Wellbeing Board is part of our wider strategic partnership landscape that operates across the Borough of Merton, that includes the Children's Trust, the Community Safety Partnership, the Sustainable Communities and Transport Partnership, the important work of the Health and Wellbeing Board, collectively overseen and coordinated by the Council's, the Borough's strategic partnership. And I'm careful with my words around there. It's sort of coordinated that the strategic partnership sits at the centre of a network of partnerships, but there's no formal reporting lines in or out, because I'm very clear in terms of the introduction Russell gave about the governance route for the Health and Wellbeing Board. But the context for Tony and my presentation this evening about stronger communities is that Tony and myself pop up on a range of other partnership groups, strategic partnership groups across the authority. So there's a reassurance, I hope, for the Health and Wellbeing Board that the work that we're leading on strengthening communities is part of that wider work that we're doing. And then the final point from myself, Chair, is that the strategic partnership for Merton, the Merton Partnership, is working on the development of a new borough-wide community plan for 2027. And as part of that, if colleagues on this board haven't yet received an invitation to the Partnership Summit on Monday, the 20th of July in the morning at AFC Wimbledon, they will shortly after this meeting this evening. And that will be an important conference because that identifies those areas of outcomes across our communities where we can make a difference by working together, not just about those wider determinants of health and wellbeing, but some of those other specific actions we do across the partnership. But absolutely endorse what my colleague Tony has said, and happy to take any questions or points of detail. Thank you, Chair.
Thank you. I can see that Christina has now joined us. Christina, we're on your right at the moment. Are you happy to speak to the Start Strong element?
Yes, and my apologies for being late in. I'm managing some connection issues today. So I'm here on behalf of Bev Hendricks to talk about the Year 2 priorities under for the Health and Wellbeing Board strategy under Area 1. I think you've got the papers in your pack, so I'm here to talk specifically around our specific actions around Start Strong. So I am going to share my screen for the benefits of those of you who don't have the pack open. And it was really to draw out some highlights of the work that we are going to focus on, building on the good foundations that we made in Year 1 of the Health and Wellbeing strategy. So we intend
Christina, we've lost you here in the chamber. Can you hear us?
I can hear you now. Can you still hear me?
We can hear you again. You're back.
Okay, so I do apologise, and I think I'm having problems sharing things as well. So I was saying that we are focusing this year on building on last year to develop our Start Strong actions. So specifically, we will be delivering all aspects of our Children Young People's Plan, particularly thinking about how we support the being healthy and staying safe action areas within our plan, and that's really looking as a system.
We've lost you again, Christina. Can you hear us?
Close to the hearts of young people around vaping and substance misuse, and on continuing to hear the voice of children and young people. Last year, we started our work with engaging with our partners and our staff around developing a strategy for addressing child poverty in Merton, which is very much about tackling the root causes of poverty, but also supporting families in poverty to engage with services and improve the outcomes of those children and families that are most affected by child poverty. So we've done a lot of engagement. We've really heard from children, young people, partners and our staff about some of the causes and effects of child poverty, and we will be using that to this year finalise our strategy and start delivery against that strategy. We are taking the learning from development of integrated neighbourhood team working and our Best Start in Life and family hubs, and really working this year to develop those hubs and take that learning to continue to support and sustain integrated team working and multidisciplinary services that really target those children and families that most need our help within those family hubs. specifically around eating well and being active, and continuing to take forward the work that the steering group has started to undertake within that space. We will be continuing to develop a model that really looks at the best balance between the food and activity environments in schools in early years, and that will be very much about encouraging children, young people to be active and address some of the causes and effects of obesity. We will continue work that we started around supporting emotional, mental health, wellbeing pathways. So under the leadership of the Mental Health Partnership Board, we will continue work to really focus on those children, young people with special educational needs and disabilities, where there are particular impacts around emotional wellbeing and mental health, and really looking about how we can create a systemic approach to supporting emotional wellbeing and mental health challenges and needs as early on as possible within a child's journey. As you will see from the slides that you have in your pack, there's a number of considerations that we will take when we are delivering our priorities, and we have indicated in our pack some particular outcomes and indicators that we are going to affect through our work. That's particularly around improving the number and percentage of children who achieve a good level of development by the end of reception, and reducing inequalities between those children on free school meals and their peers, and also addressing obesity rates and child poverty rates. I'll stop there. Very happy to answer any questions.
Thank you, Christina, and to everyone for a very concise and clear presentation. Any questions? Councillor?
Apologies, it's me again. First of all, I think the action plan looks good to me, and we've got the correct focus areas. My question is more around the methodology in delivering this action plan, particularly around the Start Strong priorities. I'm aware of approaches that we are using within health to try and improve how we deliver our health initiatives. One recent example is the trainings that are being delivered to professionals around how they spot health issues when they're out and about doing their regular job, and how they signpost people to the right support that they then need. I think the training was called Small Conversations, Big Differences, or Small Conversations Make a Big Difference, something along those lines. And I'm just curious to understand whether that same approach extends to how professionals interact with young people, particularly those from a secondary school age and above, because some of the feedback I've had from young people I've interacted with in schools is they're aware of various health provisions, but they feel like those provisions don't directly speak to them or don't directly engage them. It's either through parents or through schools that they then get access to those health services. So I'm just curious about whether we're embedding an approach that speaks directly to young people who are old enough to be aware of their health challenges, particularly around issues like mental health, and whether we can embed that more direct contact with our young people within the way we're delivering these various priorities.
Thank you,
Who wants to take that one?
Thank you, Councillor. I'll start off, and I'm sure my public health colleagues will want to join in as well. So it's a really good point, because it's so important to be able to engage with children, young people effectively at each stage in their age and age of development. So with regards to older children, as you'll know, having seen our young inspectors in action, we are always looking at how we can use our youth-led engagement approach through our young inspectors to look at areas of interest to children, young people, including around health, and use that approach of sort of peer-led engagement and questioning to really understand the issues that children, young people are facing, and what factors influence them in terms of accessing and taking up services, and what the particular challenges are. So an example there is one of our young inspectors who's just starting work around engaging with our children, young people, including secondary age children, around child poverty. And there's a real link between child poverty and health outcomes. So that's an example of some of the wider work that we're taking forward. I'll hand over to public health colleagues who might want to come in on some other specific work.
Yeah, I'd just like to endorse what Christina said in terms of the approach. I do know that we've got our new young inspector here today, and I won't put them on the spot, it's their first meeting, but I do think that they'd be very key in helping us ensure as a board that children, young people's voice around, particularly around community mental health, is informs the board's direction of travel moving forward.
Thank you, Russell. And I can see Barry's got his hand up online. Barry?
Thank you, Councillor. And yes, just to reinforce the position, we have refreshed our approach to making every contact count. So we have a pilot programme, which is the training that you mentioned there, which is really about refreshing how we deliver making every contact count across the borough, targeting this to frontline staff and the voluntary sector who do fabulous things every single day for us within the borough. So we're piloting that. We are going to evaluate it. There's more training coming in the next few weeks and months, I believe, around children's centres and families first partnership team members. So absolutely, I then would hope that we would take a report to the Merton Alliance to explore how we can embed this as a business as usual way of working to get those conversations and signposts for our services for adults and children.
Thanks, Barry. I think we've got one more question from the floor.
Yeah, so my question is on focus on prevention, and I must say I'm disappointed to see that breast cancer screening seems to be moved back again in the later years. I think it's been on our agenda for 3 years with no progress, and it's now in the years 3 to 5 years. So what's holding that up?
Thank
do you want to come in?
Yeah, thank you, Councillor. In consideration of what went on into the strategy for year 2 actions, we also considered what's coming up at scrutiny in the coming calendar year, and breast cancer screening is on the healthier communities and older people's scrutiny. So we felt that that was a place where it could go to be scrutinised and plans could be scrutinised, and we could call up well, it's St George's Hospital, who are the commissioners, to respond to the councillors' concerns about essentially Merton being the only borough in southwest London without breast screening service in situ within the borough's boundaries.
Thank you, Russell. That sounds like, sorry, Barry, I'm getting mixed up. Russell, that sounds like a very sensible approach. Barry, you've got you online there. You've got your hand up.
Yeah, thank you, Si. Thank you, Councillor, for that question. And just to reassure you that all of the actions that we are taking as a health and care system are not reflected on the very limited actions that we have within the health and wellbeing strategy. Members of our team are absolutely working with the providers of breast cancer screening and the other screening sites, screening services, as part of our oversight role to add value, to look at data and performance so that we can support them to increase uptake. So this is absolutely something that we're not shifted away from, and we are working with those providers at the same time as exploring those breast cancer screening sites that Russell mentioned.
Thank you, Barry. Councillor Kwesi.
Just a quick follow-up question on the actions around tackling gambling addiction. I'm just curious to know whether that is age specific or whether some of that preventative work will also be targeted towards preventing young people from that addictive practice and growing up to be addictive gamblers. And if it is targeted at young people as well, is that preventative work going to be done in collaboration with organisations like Catch-22, which already support young people with other addictive behaviours?
Thank you, Councillor. So we're not starting from scratch with gambling, but there's so much more as a system that we could do. So what we will be starting off doing is doing a needs assessment, looking at the need across Merton. We do have some data around for adults, but the kind of impacts on children and young people is not widely collated and data. So we'll be looking to have information gathered around the need first of all, and then set recommendations. But yes, we will be looking to very much set those recommendations in the wider context of addiction in Merton.
So could you look at age groups from like 16 onwards? Are you saying that could be done?
We would be looking at everyone who's impacted by gambling, so it could be from start of life. The impacts are across the life course, and you know, I can hand over to Barry, who's produced an excellent paper on this already for CLT. But it's really quite wide, the impact of gambling, very destructive from inception, really, in terms of life course.
Thank you, Ross. It sounds like you've got a fairly comprehensive approach in place there. I overlooked healthy places. I know, Catherine, you're online. Are you able to speak to that? Apologies for overlooking that.
No problem at all, Chair. So just similar to colleagues, I'll just pick out a few highlights and our plans for the coming year. So action 2 there in terms of embedding health and wellbeing in planning, including regen and major development. So public health is already included in our local plan. It's actually quite detailed, but picks up very much so on the improvements to the public realm and improvements to developing healthy places for our residents. So building on that, we in planning currently actively engage with public health colleagues on major development schemes, and that really is to ensure that health and wellbeing considerations are integrated with design and layout of schemes at their earliest stages. So these are major schemes that are coming into us from developers who want to develop in the borough. And we will obviously continue to do this. But in terms of schemes that we're looking at ourselves, and colleagues around the room might be aware that we're looking to bring forward the regeneration of Morden Town Centre. So with this, and this is the council-led regeneration, we will be engaging with public health regarding the vision and the design for the future regeneration. So that's the sort of the whole of Morden, but also the areas that we're working on initially. And that will be alongside other considerations, so responding to the borough of sport, for example, looking at designing places for women and girls. We are also considering whether we might look to do a health impact assessment as part of the process, which we've done elsewhere. So we're going to have conversations with public health about that moving forward. Action 4, implement council and NHS plans, and this is about reducing carbon emissions and strengthen resilience to heat, cold and flooding, which probably couldn't be more relevant to our weather today. We have a really detailed climate delivery plan actually that went to Cabinet in February, and just some highlights in terms of the works that the team have done and will be doing. We've installed a number of rain gardens across the borough. Obviously that benefits flood protection, but also increases biodiversity and increases green space and therefore cooling. By April 2026 of this year, we will have planted 1,000 trees in Merton to benefit carbon offsetting and biodiversity, with more to come. We have 2 successful bids to the Department of Education to install sustainable urban drainage systems, so THUDs, with 7 schools completed in 2026 at the beginning of the year, and another 8 to come. And we are preparing a joint paper on extreme heat for the council's corporate resilience board, and that will be going forward in July. Action 5 then, just on housing and housing quality. So we have a considerable focus to acquire good quality, sustainable temporary accommodation in the borough, helping us to move away from very expensive nightly paid accommodations. This would greatly improve the quality of temporary accommodation for us, and it allows us to really manage that. And we have a considerable grant that we've secured from MHCLG supporting that. We are also looking at the quality of the temporary accommodation that we access. So one of those things is we're part of something called Setting the Standard, which is a Pan London scheme that looks at all one-beds and studios use of TA to assess their quality. And finally on that, we have 6 weekly meetings with our biggest registered provider, Clarion, and that's to look at the provision they give to our tenants and our temporary accommodation clients. So they're particularly discussing disrepair cases to ensure that the quality of the accommodation is the best it can be. And then the last point to make on the year 3 to 5, and it picks up on the growth plan and focus, and we're absolutely going to be looking to develop that this year. So this is a growth plan for Merton, working with across colleagues to ensure that we have something that really delivers and have a focus on good growth, by which I mean growth that benefits everyone, so all residents of Merton, and within that we will have a focus on employment and skills. So, and the focus for that will be geographical and thematical, so just picking up on colleagues around child poverty and poverty more broadly across the borough. The growth plan will absolutely have a key sector on that, which will focus on looking at poverty, particularly with a focus on employment and skills. I think I'll leave it there, Chair.
Thank you for another really concise, clear update. Speakers are doing well today. Any questions for Catherine? Just checking online. No, in that case, I note the update to the year 1 actions. Does this board endorse the year 2 action plan? Note that there'll be a further, more detailed update coming later in the year, won't there, in October? I'm seeing nods in the room and nods online. Excellent. Let's move on then to the Joined Up Services Progress Report. John, you've been abandoned by Mark today, haven't you? So I think you'll be speaking to this.
Yes, thank you, Chair, and thank you for the extra pressure you're giving me. I will try to be as concise and clear as the other speakers without Mark. Hopefully I won't waffle on like too long like I normally do. Apologies, board members, I'm not with you tonight. My homeworking was planned many months before the hot spell because I've been in London all day on a course, so I didn't want to come out to the borough with half an hour to spare. We did have some slides, but I've decided not to use the slides tonight, and we'll send those around to you after the board, and Megan will send those around to you, and I'll give you the messages from the slides to save a wee bit of time. So the key message is that the work has moved on significantly since the original strategy was agreed. Russell's already mentioned this when he was speaking. I was thinking, oh my, he's going to wait to say what I'm speaking about, but the national and local context is now much broader than traditional health and social care integration. We're responding to a huge number of major reforms at the same time, including NHS plan, neighbourhood health, major SEND reform, Families First Partnership Programme, and the emerging learning from the Casey Review. Taking together, these reforms point in the same direction. While in many ways they're different, the themes are all the same. They all require us services to work earlier, more locally, and more jointly around people, families, and communities. They also require us to work away from fragmented services and towards a model of care where partners share data, identify need earlier, and coordinate support around residents before issues escalate. In Merton, we've used this opportunity to accelerate our work on integrated neighbourhood teams. A lot of the recent work has been supported by Channel 3, who were commissioned by the borough, who have worked across all partners in the system to develop the case for change, engage staff and leaders, and turn our ambition into a practical model. This has also included extensive case review workshops, design sessions, strategic leadership discussions, practitioner engagement, data analysis, and learning from national best practice. That work has shown us very clearly that we could be serving our residents much better through a much more joined up local model of care. The case reviews showed us that in a significant number of cases, earlier intervention, better coordination, and a more integrated response could have helped people avoid crisis, avoid escalation, or remain more independent for longer. So the model we are developing is really about one door, one story, and one local team wrapped around the resident or family. It's about care and support being local, proactive, data-driven, and coordinated, rather than our residents having to navigate multiple different services and tell their story repeatedly. Our first pilot has been agreed, will be in the Morden Primary Care Network, and it's due to be up and running by September. Morden does have wide-way surgery, so it's got a large part of Pollard's Hill in East Merton as well. And it gives us a strong opportunity to test the model, to learn in an area with significant need and strong links, of course, to East Merton as well. The initial focus will be on residents aged 65 plus, particularly people living with frailty, because this is an area we know there's a real opportunity to improve outcomes, reduce duplication, and intervene earlier before people reach crisis. But this is not intended to stay as an adult frailty pilot. We want to extend the model quickly to children and young people, families, mental health, and other population groups. This is important because the same neighbourhood model can support the direction of SEND, reform, FFPP, and the wider shift towards earlier help, family support, and prevention. We've got family hubs throughout the borough. There's one next to Wideway Surgery, so that will help us in some of the integrated work as we move along. The integrated neighbourhood teams are now being worked up in more detail. All care partners are contributing. We had a design workshop last week over 3 days with primary care, community health, adult social care, children's services, mental health, Q partners, all together in the same room for 3 days working on the model. The voluntary and community sector is particularly important to the model. We want earlier intervention and more preventive support. We need to make the most of the strong community assets we already have in Merton, and people will have heard me saying before, we've got the best voluntary sector of any borough I've worked in, and I've been in 11. Let me think what else I want to say. First INT should be up and running by September, and we'll bring a fuller deep dive back in October to the board. By then, we expect to be able to describe the model in more detail, how the pilot is working, including the operating arrangements, the MDT approach, the role of partners, and the data and population health work. And so in summary, Theme 3 is moving from a general commitment to a joined up service into a much more practical delivery model. The ambition is simple. Residents and families should be known, heard and supported closer to their homes, with partners working together around them more consistently and more effectively. Now, I've waffled along too much. I hope that was concise enough for the chair, but of course I'm here and able to answer any questions along with Terry, who's in the room.
Thank you, John. I think you've articulated quite a complex landscape very clearly and succinctly. Any questions for John? Fine. No. In that case, I note the update, the board notes this update. John, I know you're going to bring a more comprehensive, more detailed update in October. Thank you, John, and also Mark for the work he's done on this as well. I think we're moving on to the Better Care Fund, aren't we? Got Terry and Sarah.
Thank you, Chair. I'll start this item and we'll end with Sarah from the ICB. So colleagues will have seen the papers in the pack and hopefully they're quite self-explanatory. Colleagues of the board will be used to the Better Care Fund reports coming regularly. So there is usually one at the start of the year which sets out the Better Care Fund plan that's been submitted to NHS England, and then there's usually a halfway through the year update. So the papers today are setting out the plan that's been submitted, and then secondly the year-end report for how well we did in the past 12 months. Colleagues will be aware that this is a cross-cutting agenda across a number of departments within central government, with the key themes being around integration, driving independence, supporting discharge and flow, and looking at workforce collaboration. And some of the programmes that are within the Better Care Fund are linked to the work that John's talked about and are some of the starter work for that integrated neighbourhood team. There are 3 metrics as part of the Better Care Fund, one around emergency admissions, one around average length of discharge delay, and one about admissions to residential care homes. The metrics for 25-26 and 26-27 are the same metrics. Targets are different, but the metrics in general are the same across last year and the forthcoming year. In relation to 25-26, we're on target to meet 2 of the 3 targets that were set out. Metric 1, which is emergency admissions to hospital for people 65 plus. You'll be able to see in the packs that we're not on target to meet that metric for last year, but you will see some significant improvement towards the end of the year as we started to bring online new initiatives for our residents. The second metric around average length of discharge delay, again you will see peaks and troughs there with that metric, as you would expect winter being much more difficult in comparison to other parts of the year, but we're on track to meet that metric for 25-26. And then the final metric, which is around residential care home emissions for 65 plus, colleagues will be able to see in the pack that for last year we're actually on track to exceed delivery of that target quite significantly, which is really showing how our CQC report demonstrated when they came to visit us, that focus on prevention, that focus on home first is really working here in Merton, and that we're putting less people into residential care homes. In relation to expenditure, people will see that it's a break-even expenditure report for last year, with a small underspend on the DFG, the Disabled Facilities Grant, which is that fund can be carried forward each year, so it's being carried forward into 26-27. So that sets out the 25-26 performance report, and Sarah's going to talk through the 26-27 metrics and how we got to those.
Thanks, Terry. So just taking you through, and just before I begin, just to reflect on the work that we did prior to developing the plan, which was to review each of the schemes that's funded through the Better Care Fund to ensure that each of those schemes is meeting the key priorities or continues to meet the key priorities as set out by NHS England for the use of the Better Care Fund. So we did that piece of work in order to make sure that we were still funding schemes that were in line with the ambitions for the use of the Better Care Fund. So in doing that piece of work, we then reviewed the outcome of the ambitions for last year for 25-26 in order to set realistic yet challenging ambition for the year that we're in 26-27. So the first one around reducing emergency admissions for people beyond 65. We looked at the outturn and compared that over the activity over the last 3 years, and then we took into account the population growth and have set a modest ambition for improving those outcomes for our residents for the coming year. And that's based also on work that we know is intended to improve outcomes for our older residents around urgent community response, improving uptake of the virtual ward for Merton patients, and also the impact of the work that has previously been discussed in this meeting around improving neighbourhood work around multidisciplinary working and proactive care. The second metric, as Terry has talked about, improving the number of patients that are discharged on the day that they're ready to leave the hospital, and bringing those targets in line with our peer group. You'll see within the pack that we've set an ambition for ourselves to increase the number of patients that leave on that day that they're expected to leave from a target of 85.9% at the beginning of the year to 88% of all patients leaving on that day by the end of the financial year. The final target, and again, Merton compares well with peers, around maintaining a low number of long-term admissions into residential care for the older population, 65 plus. And again, you'll see the ambition in the pack is to maintain that good performance into the next year. The final piece of information in the pack just illustrates in broad summary the areas that the Better Care Fund money is targeted. So you'll see schemes that are related to technology and equipment, intermediate care, housing related schemes, reablement and rehabilitation, and support for carers. And some of that is delivered by our voluntary sector colleagues, by social care, and by our community health provider. And you can see that the split of the funding is broadly balanced between social care, intermediate care, and neighbourhood health and care. I'll finish there and open to questions. Thank you, Chair.
Thank you. Councillor?
Thank you, Chair. So, I love having metrics, love having some figures, and the comment on some of the previous reports. I know it's early days, so we're just setting out high level things, but I'm looking forward to getting more numbers and targets and things in the reports that we're going to be receiving later on. So this is fantastic. So on the average length of discharge delay, so the figures have got worse over the course of 25 into 26. We're looking to improve them again, but I'm not sure I heard how we're going to do that. Could you say a little bit about that?
Shall I take that one? So I think the deterioration in the performance could have something to do with the fact that it's a brand new metric, and so hospital trusts are using this metric and we're collating that information. So I think improved recording sometimes makes things look worse whilst we get to a point where we're more accurate in our recording of when a patient enters the hospital, what date are they expected to leave, and so I think there is an element of that. I think there are work streams such as a home first work stream, which is asking hospitals to look at their processes around when a patient is ready to go, they are no longer requiring acute care, making sure that everything is in place for them to leave the hospital on time. So are their medications ready? Is transport booked? Are services ready to receive them on the day that they are ready to go? So there are work streams in place to look at all of those things, which should improve that metric in totality.
And just to add to Sarah's point, the metric being new is a key thing. So when you look at different data sets, they do look very different. But for the report, we have to use a particular data set that NHS published. But then if you look at our data set, they're a little bit different. So so hence the why as well, some of that.
John, I can see you got your hand up online.
Sarah has been quite diplomatic, of course, as well, with the hospitals looking at their pathways. The minute that the medical team said someone's clinically ready to leave, the hospital the clock starts ticking. The hospitals still have a number of tasks that they need to undertake. And that's one of the things that project is looking at, because people's medication, equipment, all of the transport, everything needs to be in place before that person will go home. So that's why the trust need to tighten up their processes as well.
Thank you, John. Any further questions? Just checking online. Okay. Does this board approve the year-end report for 25-26 that Terry's presented and the 26-27 plan that Sarah's presented? I'm seeing nods here. I'm seeing nods online. Excellent. Thank you. So moving on to any other business. Is there any other business that anybody would like to raise? No? In that case, thank you everyone for your contributions, and speakers for being so effective today. It's made my job as chair a lot easier, and you can have some of your life back. We've finished this meeting a little bit early.
Thank you, Chair.
Thank you, everyone.
Thank you.
Peter now has a lot to live up